Travelers are no longer required to wear face masks on board most airplanes and other forms of public transit. Here to answer your questions about that and a lot more, Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Nice to see you, Doctor.
Hey, Dr. T. All right, here we go. We've had a lot of developments since a federal judge decided late yesterday to strike down the CDC's mask mandate. So let's start with the MBTA. Minutes ago, we learned it is lifting the mask mandate for all trains and buses except the ride service, and they're doing that effective immediately. Do you have any public health concerns about that decision?
Well, I do, Eddie. First, let's start. I don't like the fact that a federal judge overturned what the CDC guidance is, our sort of top public health officials in the U.S. But with that aside, I do think what's still in place is that masks are optional. So I want to say a few things about that. Vulnerable people, immunocompromised, obese, chronic heart-lung disease, diabetes, these patients that are still at risk, it's important to really consider masking during this type of transportation, and not just on planes, because planes actually have much better ventilation than buses, trains, cars, etc. So I think that's the first thing. The second point to remember is that masking, for individual risk, you really want to make that assessment. But I do think that if you're vaccinated, if you're boosted, knowing that there are antivirals, now we're in a much better place. So I'm really okay with otherwise healthy people, not masking. The last point is that so some of us are cheering with this, and that's understandable. I'm happy about that. But others are probably very concerned. Remember, if you're concerned and still want to travel, you may want to upgrade your mask. If you're wearing a regular surgical mask, you may want to go for that N95. Those are the type of things I'm thinking about.
Okay, so you talked about the airport. So in your opinion, could these decisions raise the infection risk at Logan?
Maria, of course they will. And as cases are going up, if we're less masked, we're more exposed, of course there's going to be more likely to get infected. Again, what I hope is those vulnerable people or people who are unimmunized or not boosted will consider masking still.
Dr. T, our Mary Saladin has been at Logan Airport, and passengers that she spoke with say that they're divided about this policy change. Obviously, everyone would like to move on from the pandemic. But the question is now the right time to do that, or is it too early?
Well, here's the good news, Ed. We're at a time when, especially look at Massachusetts, 80% of us are fully vaccinated. If you look at the 65 and older population, the most vulnerable, 95% have gotten at least their primary series. And we also have these antivirals right now that work so well with just pills that you can take for 5 days that can decrease your risk of hospitalization by 90%. So with all of that, and also with the knowledge that, again, even though the mask mandate may be gone, if you want a mask, you should still mask and feel okay. But listen, it's worked in schools. We've been through this before. Kids in schools with masking, our kids are still in school. The same is going to be true here. But remember, we have to be able to pivot. This is a dynamic virus, and there may be a time in the future where we have to bring these mandates back. So it's fluid.
All right, Dr. Todd Ellerin at South Shore Health. Doctor, thank you so much. Stay well, be well.
Great to see you, Dr. T. Thanks for your time.